Dear colleagues, ladies and gentlemen, I would like to thank the organizers at the IAEA for allowing me to speak at this celebration of the International Day of Medical Physics. My name is Jake Van Dyke. I am the president of Medical Physics for World Benefit, and I'm speaking to you from London, Ontario, Canada. This is the fourth International Day of Medical Physics, with the first one having taken place in 2013. The date of 7 November represents the birth date of Marie Sklodowska-Curie, who conducted pioneering research on radioactivity in Paris, and as a result won 2 Nobel Prizes for this successful research. It was indeed my pleasure to have been a participant at the celebrations of that first International Day of Medical Physics at the Curie Museum in Paris, France. Medical Physics for World Benefit is a relatively new organization. We started as Medical Physicists Without Borders, but at the request of Doctors Without Borders, Médecins Sans Frontières, we have developed a new name with the same acronym. Medical Physics for World Benefit has a mission to support activities which will yield effective and safe use of physics and technologies in medicine through advising, training, demonstrating, or participating in medical physics-related activities, especially in low to middle income environments. Thus, a major component of our activities relates to education and training of medical physicists in developing contexts. This, of course, connects directly with the theme of this year's International Day of Medical Physics, that education in medical physics is the key to success. The global needs for educational support in medical physics are enormous. It was my pleasure to have been part of a team of individuals who developed a report on expanding access to radiotherapy for cancer management and made projections out to the year 2035. The report was published in Lancet Oncology in September of last year, 2015. And in doing a thorough evaluation of global cancer incidence and assessing how many of those patients will need radiation treatment, the conclusion was that we will need 22,000 additional medical physicists over the next 20 years if equal access to radiotherapy is to be available globally. That means starting immediately, we will need to educate and train over 1,000 medical physicists per year over those next 20 years. The question is, how is this to be done? There are many lower income countries which lack education and training capabilities. Indeed, there are over 50 countries with no radiation treatment at all, and therefore with no professional education resources to support the development of new treatment facilities. There's no single nor simple answer to this question. This will require multiple approaches with multiple collaborations and multiple partners. The partners include national governments and government organizations, international organizations like the IAEA. The IAEA, over its 60-year history, already has a tremendous track record in developing radiotherapy capabilities, as well as in advancing training and education. However, the IAEA cannot do it all. Therefore, professional organizations are also involved, including organizations like the International Organization of Medical Physics, the American Association of Physicists in Medicine, the European Society for Radiotherapy and Oncology, and many others. These professional organizations are much involved in continuing education types of programs, but they have many other priorities as well. Also, there are a growing number of partnerships being developed between individuals, individual hospitals, in well-resourced settings, and institutions in less well-endowed environments. Furthermore, many not-for-profit organizations are also providing support to lower-income contexts. It is in this area that we see Medical Physics for World Benefit as providing a tremendous resource to both educational programs and in-clinic activities that can benefit from partners with broader experience and expertise. A further indication of the educational needs is the number of requests that we as Medical Physics for World Benefit have already had in our short existence. I now have email folders on 10 countries about which we have had interactions or requests. These countries include Botswana, Cambodia, Ethiopia, Ghana, Jamaica, Kenya, Mozambique, Tanzania, Uganda, and Zimbabwe. When such requests come our way, My first question to them is always, what is the IAEA doing in that country? Sometimes we get clear answers. Often the answer is, I don't know. This lack of knowledge emphasizes the tremendous need for collaboration and communication. Again, it's been my pleasure to celebrate with you the International Day of Medical Physics and to re-emphasize the importance of education in medical physics, as it is the major key to success in providing safe and effective radiation treatments. It is with pleasure that medical physics for world benefit can play a role in this important key to success. Thank you again, and best wishes as you celebrate the International Day of Medical Physics.